my name's Lilis. I'm a urology registrar based in London, UK. I'm currently on maternity leave. I'd like to present our work entitled Extravesical Use of Botulinum Toxin. Does it affect urological applications? And is it time to consider a patient botulinum toxin passport? This is the list of authors. The study was carried out at St. George's Hospital, but my participation here at ICS is funded by my current employer, who is Homerton University Hospital. As we know, bladder botulinum toxin injections are commonly performed to treat neuropathic and non-neuropathic patients with Detrusor overactivity. Botulinum toxin is also commonly used by other medical specialties to treat other pathologies, for example, blepharospasm. Often, the patients who are receiving bladder botulinum toxin are also receiving toxin in other body sites. The danger with this is that repeated toxin injections can have a cumulative effect, either in accidentally overdosing the patient or predisposing them to the formation of neutralizing antibodies. This study is a snapshot of patients receiving bladder botulinum toxin and also receiving botulinum toxin in other parts of the body. So firstly, we contacted Allergan, who supply Botox, which is a toxin approved for use in bladders. Essentially, the maximum cumulative dose that a patient can receive should not exceed 400 units in a 12-week interval. What we've done in this study is compiled a list of all patients receiving bladder toxin injections between October 2018 to October 2019, and it came to 105 patients. We then looked into their records, and 25 patients were excluded as there was no documentation found regarding their injections. Of the remaining 80 patients, 7 were receiving botulinum toxin injections in other body sites, which amounts to 9% of patients. This table is a detailed breakdown of each of these 7 patients. It shows what area was injected, the indication, the type of toxin used, and its respective dose. Also, the frequency of the other site injections are noted. The 2 green columns are showing the patient's bladder toxin doses and frequency of treatment. As you can see, these patients received a variety of treatments using various different formulations of botulinum toxin with their different respective doses. This in itself can cause confusion, as the units for NeuroBlock, for example, are vastly different to Botox, and there is not a straightforward conversion. In our results, 6 of the 7 patients were neuropaths, and they received injections for neuropathic conditions. For 2 of them, we could not find the dose of toxin they received, and for 1 of them, we could not find the type of toxin used for their other site injections. In general, repeated and high doses of botulinum toxin injections seem to have a risk of causing the formation of neutralizing antibodies, which would cause the patient not to respond to any type of toxin therapy. The patients who receive higher doses and in more than one site tend to be neuropaths and are multi-comorbid, which already puts them at higher risk for adverse effects from toxin treatment. The caveat to this is that in some instances, patients may develop neutralizing antibodies and yet continue to respond to botulinum toxin treatments. One other theory is that the proteins that accompany the neurotoxin in certain botulinum toxin formulations stimulate the production of neutralizing antibodies. So perhaps formulations that do not contain these proteins should be used instead, such as the brand Xeomin. However, these formulations are not currently approved for bladder injections, and it's worth noting that this theory is brought forward by competitor pharmaceutical companies which produce protein-free botulinum toxin formulations. In conclusion, it is paramount that all clinicians are fully aware of patients' toxin history, lest we inadvertently cause harm. Our study shows that the lack of documentation is concerning. To help resolve this, we suggest the adoption of a pan-hospital botulinum toxin passport, much like a warfarin booklet here in the UK. Every encounter where the patient receives any type of toxin treatment can be documented in the passport. And in this way, it's easier for clinicians to determine whether it's safe to proceed with treatment or not. Thank you for listening, and please feel free to leave any feedback or comments below.